Good afternoon to all of you. Okay, today what we will do now, we will offer respectful gratitude to Sansthan, all the team members and MP Khemka sir by reciting one prayer of Sansthan. Usually it happens every day there. वह शक्ति हमें दो दया निधे कर्तव्य मार्ग पर डट जावे पर सेवा पर उपकार में हम निज जीवन सफल बना जावे हम दीन दुखी निबलो विकलो के सेवक बन संताप हरे जो है बिछुड़े भूले भटके उनको तारे खुद तर जावे छल द्वेष दंभ पाखंड झूठ अन्याय से निशिदिन दूर रहे जीवन हो शुद्ध सरल अपना सुचि प्रेम सुधारस बरसावे निज आन मर्यादा का प्रभु ध्यान रहे अभिमान रहे जिस देव भूमि में जन्म लिया बलिदान उसी पर हो जावे में दो दया निधे कर्तव्य मार्ग पर डट जावे में दो दया निधे कर्तव्य मार्ग पर डट जावे. Okay, so I think in this same three group there are almost 90-95 students are seen in the group WhatsApp group, but here very less students are actually attending the class. I don't know why. Okay, whatever it may be. We will begin today's class with the treatise 4. Already in the group I have sent one PDF file of diagrams only. So this is treatise 4. In this, Dr. Ols all the 14 meridians are mentioned in detail. How much points and that additional points and this different. What is the difference from classical acupuncture? All the meridians. So we'll begin with the treatise 4, chapter 1, page number 1. So in that, it is mentioned about all the 14 meridians of TCM, how much points are in every meridian in classical acupuncture, and how much points are there in electro acupuncture according to Voll. So difference of the point, everything is mentioned. You can see heart has actually 9 number of points in classical acupuncture, but here in EAV these are 17. So extra 8 points are there in EAV. So we'll be seeing that one by one in detail. Like that, every meridian is mentioned. So it is given that total in each side of the body is 309 points in the classical acupuncture, and both the sides into 2. So 618 points are there, and conception vessel 24 and governing vessel 27. So grand total is 669 points are there in classical acupuncture. But in EAV there are total 944 points. So almost 274 or 275 points are extra in this EAV. So come to the page number 2. Again, everything is mentioned here again. the same thing. And on page number 3, you can see the which we have already studied in treatise 3, all the 8 meridians. Okay, tissue meridians points are mentioned. Now come to the page number 4. It is the same information again. They have repeatedly given here. Electro Acupuncture according to Dr. Voll. Its main features. Everything is given. Diagrams are there. You can come to the page number 7. Here, kidney meridian. Second point. K1 on the sole of the foot is there in the TCM. But according to EAV, kidney meridian starts from the inner side of the nail of the smallest toe. That is 5th number toe. Okay, and then from here it goes through Chinese K1 in the sole of the foot. Then EAV, the points of the meridian, this meridian is also different till ankle. Then according to EAV, Chinese point K1 is the deep limb of the kidney. These are some specific features they have mentioned here in EAV, this treatise 4. All the meridians. The points of the urinary bladder meridian on lumbar and back of the thigh are also different in EAV. We will see that one by one. Where are the classical acupuncture points are located and where these EAV points are located. Then 4th point, triple warmer meridian is known as endocrine meridian. You have to remember this always. Triple warmer meridian is called as the endocrine, means it takes care of all the glands and all the hormone secretions, endocrine mechanism in the body. And pericardial meridian is called as the circulatory meridian, means all the circulatory system in the body, like arteries, veins, etc., capillaries. Everywhere blood supply is there in the body, so that network is taken care by any disease of any complaint regarding the circulatory system is taken care by this pericardial meridian. So it is called as the circulatory meridian according to EAV. Then according to EAV, spleen meridian is only on the left side. Correct. In classical acupuncture, what happens? Spleen meridian is on the both the sides, means on both the legs, lower extremity. But here on the right side, it is considered as that is pancreas meridian. Spleen pancreas is connected to each other. Spleen pancreas. So spleen meridian is on the left side because in the body, spleen is situated on the left side, and on the right side of the spleen there is a pancreas. So right side leg, the spleen meridian is called as the pancreas meridian. Then EAV, the right side of spleen, okay, pancreas, correct. Then come to the next page, 8th number. Then again the same points nomenclature is being mentioned here again. Whatever we have seen already in treatise 3. That is CMP, control measurement point, RP, SMP, PSMP, MP, etc. Okay. So we will skip this. You have already seen that. Now come to the page number 12 directly. And that is principles of electro acupuncture. So again, it is same thing repeated again. In the treatise 3, we have already seen this. Excessive energies like itis, like arthritis, spondylitis, stomatitis. That's the same thing. It is repeated again. Then the premonitions of diseases and treatment. This humoral phase and cellular phase. We have already seen that also. These 6 phases of the diseases. Then indications of diseases are as follows. Again, that same thing is repeated. And foci. We have already seen that also. Foci, according to Dr. Voll. These are the different foci where the infection or any type of ailment occurs. Eyes, ears, tonsils, nose, teeth, larynx, pharynx, etc. Okay. So come to the page number 16. Fundamentals of acupuncture. Again, they have mentioned some history about how Dr. Voll has search these points where he applied that voltage, lower voltage machine, and how much volt is there at which point of the location on the body, and according to that he has searched different points. And it is only on page number 17 you can see the first three lines. What is meant by acupuncture point? Like physical electric energy is stored in electric battery, similarly acupuncture points located on meridians have centralization of energy, and this principle is proved by Dr. Voll by an electronic instrument which is called as the dermatron. You have to remember this one term, dermatron. He has used dermatron machine. So with the help of that machine, applying the different voltages on the specific points on the body surface areas, he has found out the acupuncture points. So again, the same thing is given. That is not important that in detail to get that machine and to stimulate with the help of machine or breaking the needle, because that's not our job. In Sansthan, we are using only harmless methods, non-invasive techniques, that is applying the pressure or with the help of seeds and magnets, beyond magnet. Okay, so directly we will start with the chapter number 2 on page number 19. You can see now we will see the lung meridian. I hope that you all may know about the lung meridian in the classical acupuncture. Lung meridian. Can anybody tell me the course of the lung meridian according to classical acupuncture? Anybody voluntarily? Do you remember the thing? Lung meridian's courses begin from the thumb, but which side? Correct. Very good. It's a radial side. And in case of Dr. Voll, where it is? It is on the ulnar side. See here. According to EAV, this meridian starts from under the second rib of chest and travels to upper arm and wrist and terminates at ulnar side of the thumb of the hand. So it is on the ulnar side, opposite side of the lung meridian. Here it ends. In Chinese acupuncture, lung meridian goes till the radial side of the thumb of hand. Acupuncture therapy should take care of both of these locations, and at the time of giving treatment according to EAV, one should treat the path described in EAV. Okay, number of points. See, total number of points according to Chinese TCM, there are 11 number of points on the meridian, lung meridian. But here 7 new points are there. That's why it total becomes 18 points. So specifications are given. EAV following 7 points are discovered on lung meridian. Where are they? You can see in the diagram also. Okay. Let me share that. At least we can see the diagrams again and again. And according to diagram, yes, these are the points. This is lung 1, 2, 3, 4, 5. Then here 6 is there. 7, 8. Generally, you have to remember that Dr. Voll has found out most of the points on the extremities, the last part of the extremities, both the extremities, the additional points. Okay. Are you able to? These diagrams are visible. Whatever I am sharing. that are given in your book also, but to see again and again, I have just scanned those and shared those to the screen. So again, you can see LU10D here. LU10D is for mediastinal plexus, and we will see the CMP. You have to remember always, that is 10C. Now the questions will be asked in this fashion, like what is the CMP of lung? So for options will be there. You have to choose LU10C, that is the CMP of lung. That will take care of all the lung diseases. CMP. You can see in the diagram, CMP is specifically given like a black dot is there, and outside there is one black ring also. That is a CMP. Okay. Then other different parts of the lungs are there: bronchioles, pleura, bronchial plexus, larynx, pharynx, hypopharynx, etc. These are the MPs, measurement points for all those organs specifically. Then in EAV, following 5 points are redefined. Some points are redefined, means their functions. In the classical or Chinese acupuncture, their functions are little bit different. And here, according to Dr. Voll, the same points, but having a different functions. He has investigated that thing. He has discovered all these points and redefined on the lung meridian. So LU11 for lung parenchyma, means alveoli and all that. Then parenchyma, then capillary network, and LU10 is MP for bronchi, LU9 for trachea, veins of upper extremities and arteries of upper extremities, LU8 and LU7. So in the classical acupuncture, we have seen that LU7 is used for the distal analgesic point for the stiff neck or neck, back of the neck, then upper back, and back of the head. Now he has mentioned the autonomic innervation points of in every meridian, which is related to which organs, and those organs are supplied by which nerves, that is innervation. So there are 3 related plexuses to the lungs, which are the bronchial plexus, mediastinal plexus, and cervical ganglion. So for the specific, if autonomic innervation problems are there, in functional problems of the lungs are there, so they have mentioned 3 plexuses of the nerves, and according to that we have to choose the points. For bronchial plexus, LU9A, mediastinal plexus, LU10B, and cervical ganglion, that is triple over 1A, that is SN for the cervical ganglion. And again they have mentioned the LU10C, the CMP of the lungs. Now we will see every point's detailed mechanism or functions of every point. Okay. Now LU11, what is the function? I do not see any response. Am I audible?
Yes, sir, we can hear you.
Okay. So this LU11 is MP for lungs parenchyma. Parenchyma means the lung proper, lung, this all the functionality. That is alveoli of the lungs, where lungs inhale oxygen and exhale carbon dioxide. Proper alveoli means lung parenchyma, where alveoli are there. And MP for capillary networks. So it is used for asthma, then allergic asthma, and it increases the working capacity after the treatment. If some alveoli get obstructed due to some allergens, then it is very useful. And in cases of the cancer of the lung. Then LU10D, you can see the locations. LU11 is on the thumb, but it is on the ulnar side. Always remember ulnar side. And we have already seen the lymph vessel meridian. Lymph meridian of according to Dr. Voll is on the radial side. That means these points are corresponding to the actual TCM lung meridian, but this is on the opposite side. So LU10 is for mediastinal plexus, again for asthma and all that. Then LU10C, this is the CMP for lungs. Now any problem of the lungs, means asthma, allergies, any problem of the lung, we have to use this LU10C point. Where it is located? This is the second phalange. This is interphalangeal joints below the interphalangeal. Anatomically, it is above. In the diagram, after first digit on the second digit, the concave part, 10C, LU10C. Okay. It cures the thysis, pleuritis, inflammatory processes in the lungs, bronchitis, everything. Excessive deficiency of energy in the lung, the asthma, emphysema. Emphysema, where lungs become almost fibrosis is there of the lungs. Lungs fields are almost gone there. Then dyspnea and release the vital capacity. Then LU10A is MP for pleura, LU10B. So if it is MP for pleura, then it is for the pleurisy or pleural ailments. Any disease regarding to the pleura. Pleura is the covering of the lung. So we have to remember that. See, lung parenchyma, then we are coming out little bit. This is pleurisy, then 10B, MP for bronchioles. Now the bronchioles. Low energy in the lungs causes deficient functionality of the bronchioles and all that. Okay, again it is important point for emphysema. Now lung 10, it is the MP for bronchi. Now it's a big bronchioles becomes connected each other and comes to the bronchi. The bronchitis, then bronchial asthma, bronchiectasis, bronchial carcinoma, etc. Then come to the page number 27 directly. LU9A, that Dr. Voll has discovered these points. LU9A is the MP for bronchial plexus and MP for brachial plexus also. Okay, LU9 is MP for trachea. Any complaint to the trachea, regarding trachea, we have to use LU9. LU8B, MP of larynx, LU8A, hypopharynx, then LU8 veins of the upper extremities, okay, and LU7 arteries of the upper extremities. Means in upper extremities, if you are having some veins problems, varicose veins, generally it doesn't happen in the upper extremities. It's commonly happen in the lower extremities, varicose veins, especially the ladies or the workers who are in a standing position in their work. So we have to use that LU8. It's a very important point for the this varicose.
So, varicose vein is the issue of lung, not lung but liver, right? So, why would we treat lung meridian and not liver in this?
No, see, there is a very good connection lungs and all the veins, because even in the Chinese TCM, according to TCM, lung 9 point, LU9, it is called as the
Mother point.
Yeah, means it's a corpse reviver. It is called as a corpse reviver. Even patient is deteriorating in his condition of ill health. So if you are using this LU9, it will give the life to the patient. LU9 is very important point. So why all the lungs, all the vessels, arteries and veins, they contain what? Blood. And blood's main content is oxygen. They are carrying oxygen and giving, providing to all the tissues in the body. And oxygen, where it comes from? From the lungs. So lungs gives the oxygen, and blood carries it and provides it through all the blood vessels. So blood vessels, blood and lung is having very near connections with each other. So in the lung meridian, we have to remember that there are various points which are very useful to treat the blood or the blood vessels or arteries and veins and capillaries, all the ailments of these things.
So if there is hardening of arteries or veins, like say for example in the hand, in the palm of the hand,
Yes.
the artery or vein gets फूल जाना, वो थोड़ा बड़ा हो जाना, या it
Yes.
hardens. So even then we have to use LU9 tone.
Yes, LU9. See, if it is a hardened, then LU9 sedation.
Okay.
And it is in Dr. Voll's, they have mentioned LU8 for veins of the upper extremities. If it is vein, then we have to place LU8.
And so what about lower extremities if there is a similar problem?
Yeah, it is, we will see that point also. In the lower extremities, some points are there. In pericardial meridian, we will see that later.
Okay, sir. Thank you.
Yeah. LU7 for arteries, then for asthma, first clear the mediastinal plexus, second clear the alveoli. Okay, we have to use those points. Okay, this ends our almost lung meridian. So we'll go ahead to the large intestine meridian. Okay. Large intestine on page number 28. Now the location of large intestine meridian is same in EAV and Chinese acupuncture. This meridian starts from the radial side of the index fingers, corners of the nail, and goes up to nostril. The same thing. Now, number of points. According to EAV, there are 30 points on large intestine meridians. Means how many points are extra? 10. Okay. According to classical acupuncture, there are 20 points on large intestine. So specification in that you can see LI1B is the CMP for whole large intestine. Any complaint regarding to large intestine, anything, we have to use this LI1B. These are the very specific points Dr. Voll has redefined or he has defined these points. Now this LI1C is the MP for peritoneum of the large intestine. Large intestine is also covered with some peritoneum. That part of the peritoneum point is this. We can also call this as the serous membrane coating point, like that. SCP, LI1C. Then these different points are mentioned here. Again, those points we will study ahead. That's why I'm just going very faster. Then in EAV, following 11 points of large intestine meridian are redefined, which increases their usefulness. Then LI1, 2, 3, they have redefined. And what is the use? Even in Chinese acupuncture, these uses are mentioned actually, but little bit different functionality. In here, LI1 is used for transverse colon and sigmoid colon. Upper side of the colon, transverse colon and sigmoid colon. Then LI2, it's specifically used for descending colon and right flexure of colon. Right means this is a liver flexure. It is called as a liver flexure of the colon. Then LI3 is MP for ascending colon and left flexure of the colon. Left flexure means splenic flexure of the colon. You have to know this. You know these parts of the colon, large intestine. You might heard this in the BHB class. BHB class. Large intestine is beginning from the right iliac fossa. The abdomen has 9 parts, and there it starts right iliac fossa, where the ileocecal junction is there, and where it large intestine connects to the ileum part of the small intestine. The small intestine and large intestine is connected there in right iliac fossa, and appendix is there, one projection. So that is the cecum. part. Then from there, it is ascending colon, then transverse colon from liver up to the spleen, transverse colon. Then from spleen, it goes down on the left side. That is a descending colon. Then little bit on the towards the middle side, central part. That is a sigmoid colon. Then rectal part and anal canal. This is the large intestine structure. So the specific points are for the specific part of that large intestine organ. Li4 is for the cecum and left portion of the transverse colon. Correct. And like that, they have mentioned all the things. And Li20 for the ethmoid cells, MP for reticular bone of the skull cap between the eyes and okay, you can read it out. According to EAV, these are the following plexuses which affect large intestine are called autonomic innervation point. Means AIP, it should be AIP actually, but they have mentioned AIV. Okay, autonomic innervation. For vation, they have mentioned V. So AIV. AIV for upper mesenteric plexus. See, upper mesenteric plexus, lower mesenteric plexus, rectal plexus, upper hypogastric plexus, and iliac plexus. These are the five plexuses through which the nerve supply goes to the large intestine whole, to the different parts. And the points are given there. So CMP is again Li1B. This is CMP for any disease of the large intestine. Again, Li1C, PSMB for the peritoneum of the large intestine. Treatment of these things, chronic diseases like IBS, inflammatory bowel syndrome, colitis, diverticulitis. These all the diseases can be treated with the help of these points. Okay. Now come to the next page, 30 number. Li1-1 or on the right side, lymph vessel. Lymph vessel we have already seen, but still every part, every organ has its own lymph. So its own point also for lymph drainage. It is mentioned large intestine includes cecum, appendix. So the different points are mentioned. You can see that again while studying different points functions one by one. Okay, left flexure of the colon called splenic flexure and liver flexure. You know that. Causes of the affection of the large intestine. Yeah, they have mentioned some causes of the large intestine infection or any disorder. Silver, fluoride, copper. These are the different ions through which large intestine gets affected. Bromide and gases, all that. Okay, come to the page number 33. Large intestine meridian, LI. You will see LI1. This is the point. Li1. On the right side, this is MP of transverse colon. Treat the problems of affecting one psychological. Yeah, now I have seen a lot of patients, those having some psychological problems like anxiety, depression, or anything related to mind, disturbed mind, imbalanced mind. So in this patient, because of the excessive thoughts, they are suffering from some abdominal disorders, means that is related to large intestine or small intestine most of the times. That is also called as the IBS, inflammatory bowel syndrome. Because of the excessive thought in the mind, because of the depression, that is connected to the large intestine and small intestine disorders. Because of the because they don't have that much capacity to digest, because their digestion capacity goes down and down due to the excessive thoughts in the mind. While eating also they have thoughts, while sleeping also they have thoughts in the mind, depression or anxiety or much thoughts. Their sleep is not proper because of the thoughts, and that's why they are suffering from insomnia. And where there is insomnia, there is digestive disorders, because we have seen the inorganic clock. Because they are not able to sleep before 11 o'clock up to the 1 or 2 or 3 o'clock, and that is the main hours where the blood gets detoxified. So psychological disorders that affects the transverse colon or colons, that is called as the inflammatory bowel syndrome. In such patients, this Li1 point is very important. And on the left side, MP for the sigmoid. And on the right hand, if you are placing this Li1 point, it will be helpful for transverse colon, and on the left side, it will be helpful for sigmoid. Now Li1-1, CMP for lymph vessels of the cecum. Again, right and left side. Li1A, it controls the acid-base ratio. So hyperacidic patient, you have to use this Li1A. If it is hyperacidity, sedate this one. If it is hypoacidity, then tonify this one. Means hypoacidity, where it is there, in which conditions the patient is not properly digesting the food. Okay. Then it covers the vascular function of lower part of body, including legs. So this Li1A is also controls the vascular functions of the lower extremities. And here on the left side, it controls the arteries of lower portion of the body, including the legs. Again, next point, Li1B. This is the CMP for the whole large intestine, including the rectum and anal canal. Then Li1C, peritoneum measurement point, large intestine. Come to the page number 34. Chronic large intestine disease, then diverticulitis, colitis, etc. Scar adhesion at the operation of the appendicitis. Now Li2. Li2 on the right side, MP for right flexure of the colon, that is liver flexure. And on the left side, MP for descending. So it controls it is related to the diastolic pressure. It is mentioned there. It is related to the diastolic. We have seen how many pressures are there while measuring the body blood pressure. There are two types of pressure. One is a systolic blood pressure upside. It is normally 120, and below it's a diastolic pressure, that is normally 80. So these descending colons functions are generally related to the diastolic blood pressure. This is one of the observation according to Dr. Voll. Now Li3, MP for ascending colon. Now ascending colon related to diastolic pressure again, and here vitamin K produces, which balances the diastolic pressure. That is the physiology behind this diastolic pressure. Vitamin K absorption happens here in the ascending colon, descending, most part of the descending colon actually, ascending, transverse colon and descending. There vitamin K is absorbed in the body, and vitamin K is very much related to the controlling system of diastolic pressure, blood pressure. And on the left side, MP for the left flexure, called as the splenic flexure, because spleen is on the left side. Okay, now Li3A, MP for great omentum. These are small omentum and great omentum. These are the coverings of the bowels. Now Li4 on the right side, MP for cecum, left side, MP for left portion of the transverse. We have seen this already in the few first stages. Now Li4A is appendix and ileocecal lymph, and this is on the left side, mesentery lymph nodes is affected by fluoride, is given up here. Li5, MP for proximal wrist joint. Li5, we have seen this. Li5 is located where this, what it is, this structure is called as, this is called as anatomical snub box. This is called as anatomical snub box. At the base of the thumb, here it comes. Anatomical snub box. This, see, this is just like a snub box. Some people used to put snub here and they like inhale here. This is called the anatomical snub box. So the center of that anatomical snub box is Li5's location. So it is very useful for the proximal wrist joint. Again, the some few points everyone. LI6, from LI6 to LI10, 12, 13, 14, 16, the treatment effects is the same as per the Chinese medicine, TCM. Now LI10, LI11, it is the third MP for elbow joint. We have seen in TCM, LI11's position. It is called as the Kuchi in the TCM, this traditional Chinese. This is when you fold this elbow at the lateral end. This is called as the outer end or the lateral end of the cubital crease. This is called as the cubital fossa. This is cubital crease. So cubital crease fold is there, skin fold, and at the end, outer end, lateral end of that cubital crease is a LI11's position location. So LI11 is the MP for elbow. Okay. Then LI15 is on the shoulder. So anatomical location, its function is MP for shoulder. LI17, it cures the cervical spondylitis because it's rests at this side. This is the center, almost center of the lateral aspect of the neck, just below the sternocleidomastoid muscle. Here is the one big muscle is there, sternocleidomastoid muscle. So just in front of the sternocleidomastoid muscle, LI17 is located. You can see it's a diagram on the 38 page number. Okay, just behind this hyoid bone. This is called as the hyoid bone, where our larynx voice box is there. And just behind this, there is LI17. Actually, this is considered as very dangerous point according to Electro Acupuncture even. It's traditional acupuncture, because if you prick little deeper, it will be pricked to the carotid vessels, which supplies the whole blood to the brain. So if it is ruptured, within few minutes, patient will get died. If somebody is doing needling, in our course, needling is prohibited. So this is LI17, then LI18, again for tuber tonsil and all the neck structure. Then LI18-1, auditory canal, 18-2, that is pharyngeal tonsil, 18A for the lower odonton, 6 and 7. LI19, we have seen LI19 at the below the nose, like here. LI19 according to TCM, but here the locations are little changed. LI19 is here, they mentioned. LI19, 19A and 20. Okay, for upper odonton, 19A, 4-5, and LI20 is for MP for ethmoid cells. Also treat the LY13 or the ethmoid cells. That is, ethmoid sinus is there near to this structure. That's a ethmoid cell. Okay, so this is all about large intestine meridian. Okay. Next, we will go to the fourth chapter on page number 40, circulatory meridian. We will see these both the meridians, circulatory meridian or pericardian. In the TCM, it is called as the pericardian meridian, and according to Dr. Voll, it is called as the circulatory meridian, because pericardium controls all the vessels, blood vessels in the body, whether it is artery, vein, or capillaries, anything. Throughout the body, any vessel, blood vessel, is controlled by the pericardium meridian. So, according to Dr. Voll, it is called as the circulatory meridian. Okay, so we will see this. It's a location. This meridian starts from the radial side of the middle finger, so root of nail, goes up to fourth rib of chest. Path of this meridian is same in Chinese acupuncture and EAV. Same. Okay. Number of points, there are 9 number of points in TCM according to TCM, but here 18 points. So 9 points are newly discovered by Dr. Voll. Now, specification in that you can see this CMP, CI8D. CI8D is this main CMP control measurement point of the circulation and pericardium. In throughout body, if any disorders related to any vessel, whether it is now you can see, just you have asked just some time before about the varicose veins of the lower legs. Even you have to use this CI8D along with LU8 there and LU9 also. So CI8D is the CMP for circulation, all the vascular system. Then again, different things. CI8C, abdominal aortic plexus, then lymphatic trunk, SMP coronary plexus, axillary lymph nodes. See, they have mentioned one point, CI7A, that is for coronary plexus. Is the blood supply of heart itself. Now in EAV, following 6 points are redefined. CI9, this is SMP for arteries, specifically for arteries. Then CI8 is a SMP for veins. Now, for this is they have explored now. This is very specific. If veins are varicose of the lower extremities, we have to use CI8. In general, CI8D because it's a CMP and specific CI8. Then CI8 means pericardium. CI7 coronary arteries. If blockages or something is there in the coronary arteries, means these are the vessels which supplies the blood to the heart itself. So coronary arteries. CI7 is very specific. Then CI3 for elbow joint, then shoulder joint. Okay, allow. These are the plexuses. These 5 plexuses provides the innervation, nerve supply to this pericardium. Coronary plexus, CI7A, axillary lymphatic plexus, cardiac ganglion, thoracic aortic plexus, and abdominal aortic plexus. Again, CI8D is the CMP. Both arterial and venous system and circulation of all body system, where there is a circulatory system. Its controlling point is CI8D. Now, circulation meridian have following summation measurement points. The SMP for veins, arteries, CI9. Again, same thing. Come to the next page, 643 number page. Circulatory meridian or pericardium meridian. CI meridian means pericardium. Now CI9, you can see the diagram on page number 42. CI9. Okay, on the thumb side, this side. This is the exact position of CI9 point. Then CI8F, then CI8E, then CI8D. These are the positions, locations. Where there is the depression on the ends of the joints, ends of the bones, both heads of the bones. There are because there is a depression, slight depression. That's why there is a low volt. These all the acupuncture points are low voltage points. Understand, try to understand this. In all over body, wherever, according to even TCM, according to Dr. Voll, everywhere, where is the point's location? Exactly where there is a little depression on the bone surface. Even you can see here also, some points are there on the skull surface. This is stomach 6, 5, 6, 7, 8. Why 8 is here? Stomach 8. You can just feel it. There is a little depression on the skull, on the bone of the skull, bony structure. There is a little depression, little slight depression is there. That's why there is a low voltage. That's why there is acupuncture. Okay, then CI9 also it treats the arteries For treatment, PN4, SI1A, and FAT-D points also should be used. ST12 communal communal carotid artery, SMP for arteries. For different arteries, they have given different points. You can read it out. Arteries of the arms, LU7, arteries of the legs, ST32, coronary artery specifically CI7, like that. Now, this is autonomic steering. See, MP of iliac plexus, LI1A, abdominal aortic plexus, CI8C. Again, the same thing we have seen already. Then CI8F is the hemolymph nodes, lymph drainage. CI8E, right side autonomic innervation for aortic arch together with cardiac ventricle. Now, CI8E, you can see CI8E, left side, on the left hand, CI8E. Autonomic innervation point for the thoracic aorta and thoracic aortic flexures. Then treat to reduce the distortion of the thoracic aortic flexures. CI8B, CMP for the blood circulation. We have seen that. CI8C is abdominal aortic flexures. It's autonomic steering. This innervates, which this autonomic, this abdominal aortic flexures innervates to the, means it gives nerve supply to all these things: transverse colon, descending colon, sigmoid colon, and upper rectum. Okay. Now CI8B. This is SMP for cisterna chyli or limb cisternae. You might be knowing this cisterna chyli. Anyone of you know this cisterna chyli? Have you seen this in BHB class? What is meant by cisterna chyli? Anybody knows? We have seen the lymph drainage system of the whole body. That the thoracic aorta is there, which comes from this side. It's, from below, the lymph drainage comes up, and it drains into the this thoracic duct of the lymph vessel. So, on both the sides of the lumbar vertebrae on the back side. So that both the lumbar side lymph drainage drains into this cisterna chyli. It is a small structure. The whole lumbosacral limbs are coming and draining into this structure that is called as a cisterna chyli. You can see in Google also. You can see the diagram of this cisterna chyli. Also treat these points along with the peritoneal serous measurement point for the respective organs. Okay, because it's the lymph drainage. If anywhere there is an infection in any organs, specific organs, nearby organs, the lymph drainage is there nearby only, the nearby structure. So which lymph, that according to that point we have to use. Again, CI8A on the right side, right thoracic duct and lymphatic trunk. CI8A left side, left thoracic. Come to the page number 47. Okay, CI8. This is SMP for veins. Veins which carry non-purified blood from the body to heart. Now you can see here. Your question will be answered here. This varicose veins problem, veins of the legs, liver 7. We are using liver points for this also. And along with that, CI8. Veins of the legs, veins of the arms, LU8 and CI8. Veins of the small pelvis, SP10 and PN10 along with CI8. Veins of abdomen, ST33 along with CI8. So CI8 is very specific point for veins also. CI7B, it's a SMP for lymphatic system. Okay, CI7A, it's MP for coronary plexus of the heart. Now see, coronary plexus. This innervates the coronary vessels. Coronary vessels are the blood vessels which supply the blood to the heart itself, heart muscles, heart structure, full heart organ. And the innervation means nerve supply to that coronary vessels is from coronary plexus of the heart. And this is very specific point, CI7A. Now, CI7 is for the coronary arteries, specifically MP for coronary arteries. Means heart blockages. Heart blockages are there. You can use this CI7 point. CI7 point. Okay. Now, in that also, they have mentioned the left and right side specifically. Arteries of the left side of the heart are specifically treated by the left side of CI7. CI7 point on left side, left hand. On the right side of the heart. If we know which side is affected, so we can know this very proper, which sides points we have to use. Otherwise, you can use both sides. That is also. Now CI3, second MP for elbow joint, for elbow. You can see its location. Pericardium 3, we know. CI3 means pericardium 3. It is at the elbow joint. So this is MP for elbow joint. CI2, it is for shoulder joint. CI2, MP for shoulder joint. Because its location is just nearby to that. And CI1A, an autonomic innervation point for axillary lymphatic plexus, MP for axillary lymph nodes. And CI1 is alarm point for the circulation. We know this alarm point. In alarm point, there is one front move point and back shoe point. These are the alarm points. Back shoe points, generally all the, according to TCM, all the back shoe points of all the meridians are coming on the urinary bladder meridian. All back shoe points. And front move points are on the itself or some different meridian. Or CV channel. Now, I think this completes your CI, circulation meridian. Now, we will go ahead. This is very, very, very important meridian now, according to Dr. Voll. Actually, this is the boon from this discovery of the Dr. Voll is a boon for medical fraternity. This is triple warmer meridian, TW meridian, or it is also called as the endocrine meridian. For all the problems of hormones in the body, whatever it may be, it is very much and effectively treated with this triple warmer or endocrine meridian. Now see location, both in EAV and Chinese acupuncture location of triple warmer meridian is same in the beginning. The meridian starts from the ulnar side of the ring fingers, wood of the nail, and ends at the front of the ear, auditory meridians. Correct. From TW16 to TW23, the location of points in EAV is different from Chinese acupuncture. 16 to 23. Okay. So we have to remember accordingly. Now, number of points in the TCM in TW meridian, there are 23 points. 23 is here. Okay. But here there are 32 points. So Dr. Voll has discovered 9 more points, additional points. Now specification. In EAV, triple warmer meridian is considered as endocrine meridian. Points related to different endocrine glands are shown on this meridian. Now different, so many endocrine glands are there. Now we have to know here, where is the exact location? The center, that is extra 1 points location according to TCM. The center of both the eyebrows. This is called as a glabella as per the anatomical land. From the glabella, one arrow should be from the glabella, and the second arrow is from the you can connect both the apex of both the ears. Connect it like this. These lines, whole line, which is connecting from one ear to another ear, apex. The center of that line, one arrow from the center of this line, center of the skull, and one arrow from this glabella. If both the arrows will meet inside, that is the exact location of pituitary gland. Pituitary gland is the chief gland which controls all the endocrine glands in the body. Below this. So, and it is also under control on the hypothalamus. Okay, this is the part of the brain. So pituitary and pineal gland is also near to that. Just behind the pituitary gland, there is a pineal gland. These both are the controlling glands, through which all the hormones are regulated and controlled in the body. The different endocrine glands. Then come below. Here is the this thyroid gland. Thyroid, and backside of that is a parathyroid. Below that, there is a thymus. Then below that, you can come here, the abdomen. There is a pancreas, which secretes insulin, main hormone, pancreas. Just below to that, on both the sides, there is a ovaries in the female and testes in the male. Okay, these are the endocrine glands. And on the back side, on the both the above both the kidneys, there are the suprarenal glands. Okay, these are the endocrine glands through which different types of hormones are secreted, which controls the different activities in the body. So the main is the pituitary gland. So we will see this one by one. So there are different points for different glands and their dysfunctions. We'll see that one by one. Now EAV 9 points are discovered. This triple warmer 1A, PSMP ganglia of neck, then triple warmer 1B. See, this is very important point. Where there is a irregular menses or any endocrine system problem, any hormonal disorders, we have to use this point, triple warmer 1B. This is CMP for whole endocrine system. Then specifically for pancreas in diabetic patient, we have to use this point, triple warmer 1C. Okay, endocrine, TW1C, MP for pancreas. For mammary glands, in the after delivery in the ladies, there should be milk. If absence of milk is there, we have to use this TW1D for mammary glands. Or any problem, if milk is not coming, we have to use this. Again, from means cancer or lump or any tumor in the breast, we have to use this for mammary gland, TW1D. Then MP for deep cervical lymph nodes, TW16A. Then for facial nerve, then mastoid sac, the brain, cochlea. That is. So now very specific. EAV following 14 points are redefined. See, the suprarenal glands. PSMP for gonads and suprarenal gland is TW1. TW2 is for PSMP for parathyroid and thyroid and thymus, all the three. Then TW3 is PSMP for pituitary and pineal gland. Page number 51. Now TW16 is MP for anterior lobe of pituitary gland. This is very specific, anterior lobe of pituitary gland, because it takes care of more hormones and more glands. Now TW20, which is a MP for hypothalamus, which is the main controller of all these glands and even pituitary. Now the fourth point, suprarenal plexus. This plexus is the kidney meridian, is in kidney meridian, suprarenal plexus. This meridian innervates the adrenal gland, gonads, etc. Now come to the page number 52. In triple warmer meridian, one control measurement point, that is TW1P. It's very important. Again, the same thing is repeated, gonads and all that. The last line, one can treat different endocrine glands, ear, eyes, neck, etc. by giving treatment on these points successfully. So this is very important meridian. The diagram is shown in the on page number 53. Come to the page number 54. We'll see one by one uses of these various points. Okay, we'll cover this meridian and we'll stop today. TW1, this is PSMP for gonads and suprarenal glands in adrenal glands. Suprarenal glands and adrenal glands. and gonads. Gonads means testicle in males and ovaries in females. Suprarenal glands are adrenal glands, adrenal or suprarenal. An indicator drop, the excess or deficiency of energy at TW1 indicates a problem of either gonads or adrenal gland. Indicator drop means if you are using that voltage checkup machine, so low voltage. UV22 helps diagnose if adrenal is affected, and spin 11 helps diagnose if gonads are affected. Why it is differentiating point? Can anybody tell me? If adrenal gland is affected, then he has mentioned UV22 helps to diagnose. Why UV22? Can anybody tell me? UV22 is the backshoe point of what? Triple Warmer meridian. So triple warmer's backshoe point is UV22. That's why it is given that UV22 is helping to diagnose the adrenal gland is affected, and SP11 helps to diagnose the gonads are affected. Because when we will study SP meridian, you can see the SP11 is the summation point for SMP for this gonads specifically. That's why it is given. For ring finger amputees, use UV22 place of TW1. Now for gonads, treat all these points he has mentioned, and for testicles specifically, and for ovaries he has given specific treatment. This TW1, SP11, PN11, then ST31, LI11, TW1P, SP12, PN12, and UP64. For what purpose this is useful? In infertility cases also we are using these points. In infertility, irregular menses, or any hormonal disorders in the female especially, because these points are related to ovaries.
So for PCOD also?
Yes, for PCOD also. For adrenal glands, treat this point. TW1, UV22, TW1B, all that.
What about acne connected to the menstrual cycle?
What?
What about acne or pimples connected to the menstrual cycle?
Yes, definitely you have to use this point. Because acne are generally connected to, means in female, we have seen because of the hormonal changes before menses or after menses. This is because of the estrogen and progesterone effect. Estrogen is more causes this skin acne and pimples. So we have to use this point. They're very much useful for these acne pimples also in that condition. Now the next point is dehydroepiandrosterone, that is DHEA. This is one steroid hormone actually, which is produced by the adrenal gland, and people more than age over 50 experience the deficiency of this hormone, and there is a more and more threat to heart problems, heart disease. So treatment on this increases the secretion of DHEA hormone, results in regeneration of muscles in old people, and reduces the threat to the heart, and patient starts feeling good. Treat the TW1 point. TW1 for after age 50, if heart problems are more, if the lower levels of DHEA is there. Now come to the page number 55. TW1-1. It is not 1-1 actually. 1-1 is not the point on the triple one. It's a one only. TW1. It says maybe it's a printing mistake. Lymph vessels of the endocrine and mammary glands. Okay, so for the treatment of tumor of pituitary glands, goiter, tumor of mammary glands, tumor of ovary, you have to use this point, TW1. Very important point. Now TW1A, PSMP for ganglia of the neck. So anything related to neck problems, you can use this. Cervical spondylosis. Then TW1B. This is a CMP of endocrine gland, endocrine system. This is very important part. TW1B. Okay, you can see its location in the diagram. TW1B, where it comes, it is at the lower end of the second phalanx. The middle phalanx lower end or the upper end as per anatomy, like this. Okay, this is SMP, CMP. Now, when we have to use this CMP also in two techniques. Like if it is suppose somebody is having hypersecretions of the hormone, like for example, hyperthyroidism is there. Hyperthyroidism means in such cases we have to use the thyroid related points, and along with that TW1B, because it's a CMP for endocrine system. But what we will do in such cases, if it is a hyperthyroidism, sedate this point. If it is hypothyroidism, tonify this point. Likewise, you have to apply the magnets, tonification and sedation. We have to see whether it is a hypersecretion of the hormone or this disorder is because of the hyposecretion of the hormone. And according to, we have to sedate or tone these points. This specifically TW1B. Then come to the TW1C on the right side, MP, internal secretion of the head and body of the pancreas. So this is very important for diabetes. On the left side, MP, internal secretion of the tail of pancreas, investigate here for diabetes. So diabetes formula, it's a very important TW1C, TW1B and PN3, that is spleen 3 on the right side. These 3 points are very important. Tone these points in diabetic patient. Tone all. Tonification of all these 3 points. It's very important for diabetes patient. TW1D is for memory. Then it controls the peristalsis movement. It gives the forward push to the bolus. The general waves like movement to push the forward food from the stomach to the small intestine to the large intestine. It controls the absorption of the nutrients. For the tumor, treat the mammary glands also. For tumor of breast, treat the following points. See, breast tumor, these 3 points, TW3, TW1D, SC41A, and TW1B. It's very nice protocols he has mentioned in this book. Now come to the TW2, PSMP for parathyroid and thyroid and thymus. All the 3 glands. Thyroid gland.
So these will be torn or sedated?
In case of?
Tumor of breast.
Yeah, tumor is the hyper, no? It's a hyper function, so excess. So sedate this.
Okay.
So TW2 is PSMP for thyroid, parathyroid, backside, and thymus. All the 3 glands are covered by this point, TW2. Okay. Now you should know this. Thyroid gland controls the maturity and growth in the body. Then which condition hyperthyroid is called as, and which condition hypothyroid is called as. Okay, this hormones, this gland secretes the hormones thyroxine and thyrocalcitonin. The parathyroid, again, the parathyroid is located at the back side of the thyroid gland. It secretes the parathormone. These are the form of a small glands, 4 on the back side, 1, 2, 3, 4. Parathormone is secreted with this gland. Parathyroid gland controls the calcium metabolism in the body. So hyperparathyroidism and hypoparathyroidism. These are conditions. Thymus gland, these are very prominent in the under the age of 14 years. It functions is immunity. It boosts the immunity. This gland speeds up the physical and mental growth of the children. After 40, it is not seen. So treat the balanced autonomic steering of the thymus gland. These are the treatment points. TW1B, TW2, and ST40. ST11 plus all these points. Now thyroid gland, it is given 3 points. Parathyroid gland, again 3 points. Now TW3, PSMP for pituitary gland. Now we have seen here pituitary and pineal, both the glands inside the brain. PSMP for pituitary gland and PSMP for pineal glands also, TW3. It's a very important point. In each and every thyroid disorders, you can use this TW3 point. It's a master gland, pituitary and pineal gland. Pituitary gland have three parts: anterior lobe, posterior lobe, and medial lobe. So anterior lobe, for specifically anterior lobe, it has given TW3, SI15, TW16, GB21, TW1B. Specific protocols for specific, if we know by the reports of different investigation reports, if the problem is there in the anterior pituitary or the hormone which are having some problems inside the body, if those hormones are secreted or the controlled especially by anterior pituitary, then use these points. Posterior pituitary, posterior lobe of the pituitary, these points, and medial lobe of the pituitary is this point. Okay. So when disturbance in pigment metabolism results in the color change of the body skin in white or black, treat medial lobe of the pituitary gland. They have mentioned some specific things here. Okay. To decrease the quantity of urination, treat posterior lobe of the pituitary. Treat diabetes also on posterior lobe. Then baldness, then low lactation in mammary glands, less growth of the body, low sexual function, worse skin color, and treat anterior pituitary for these problems, skin and all that. We have to treat the anterior pituitary. For pineal gland, they have mentioned these 4 points. Okay. Growth of the body stops due to deficiency of growth hormone, treat these points. Muscle of old people become weak, treatment of this point strengthens the muscles of the old people and corrects shrinkage of the old body. So it gives the strength, muscular strength in old people also. Now TW4. This is the MP of wrist, because we know TW4 where it comes, it is the center point of this wrist joint on the dorsal aspect. So this is the TW4. That's why it's the MP for wrist joint. Then MP for shoulder, clavicular joint. TW14 direct. 14 is here. You might be knowing TW14 is the back eye of the shoulder. There is the front eye and the back eye of the shoulder. Front eye, there is LI 15 number point, and on the back eye, that is triple warmer 14 number points. That's why it's MP for shoulder. Then TW15, this is SNP for joints of upper extremities. Then TW16 MP, anterior lobe of the pituitary. Again, the same thing is mentioned. TW16A, MP for deep cervical lymph nodes. So cervical spondylosis is there, then treat this point also, TW16A. Now you can see the 16A position on the next page. Diagram is there, page number 60. From here, all the locations they have already mentioned in the previous pages. From the TW16 up to TW23, the locations of the points in this triple warmer meridian, according to Dr. Voll, is completely changed. The location in the TCM is here. 16 is here, backside. 17 is the below the ear. 18 is backside of the ear on the lower part. 19 is backside of the ear on the skull, this backside, upper part of the ear, and the apex, above the apex of the ear, that is 20, TW20. Then 21 in front of the tragus, this is called as a tragus of the ear. Then 22 is just in front of that half cone, front of the 21, that is 22, and 23 the lateral end of the natural eyebrow, this is 23. But here locations of these points from 16 to 23 is changed. You can see this. So at the time of the treating the middle part of the ear, eye, sinus, jaws, teeth, head, neck, because this is a lymph, whole lymph, cervical lymph node point. No? So 16, because it is the necessary to correct the lymph secretion of the head. This is very important point of EAV for the treatment of the foci in the head area. Where there are foci means exact location of the infection, the different foci, eyes, ears, nose, everywhere. So lymph drainage through the deep cervical lymph nodes also treat the thyroid, parathyroid, upper deep respiratory tract, the larynx, the trachea, esophagus of the cervical spine. Everything can be treated with the help of this point, 16A. See the location just below the earlobe, below the earlobe. Now 16A1. This is MP for facial nerve, 7. It is specifically used for ptosis of the upper eyelid. Ptosis means the palsy of the upper eyelid. Ptosis. There is again and again patient is doing like this. Means there is no control over the movements of the upper eyelid. Treat the facial nerve problem here. The facial nerve paresis causes an autonomic paralysis of the circular eye muscle, causing flaccid weakness and incomplete closure, and hence a gaping protrusion of eyeball, loss of tonicity in lower lid with unsatisfactory tear drainage. Okay, so for the ptosis of eyelid, upper or lower eyelid. Now TW16A2. This is mastoid cells again. Here, mastoid cells. Now these points are going above the ear, on the ear. Okay. Now TW17, where it is? It is at the junction of this this is tragus, this is antitragus, just on the antitragus. This is prominent part again of the ear, antitragus. There is the location of TW17. Middle ear is air-filled cavity which communicates anteriorly with pharynx. This is the SMP of middle ear. Anything, otitis media, hearing problem, pus in the ear, earache, or hole in tympanum of ear and pus, treat this point. Along with that, lymph drainage point of LY1-1 and LY1-A. This is specific point, TW17. Now TW17A, just above that, on this area of the ear, okay, where according to auricular acupuncture, there is a spine. Spine is there, spine's points are there. This is the cervical spine, then this is the thoracic, then lumbar, then sacrum. These are the spine points actually, but here, according to auricular acupuncture, that is a different part. It is not, I think, in your syllabus. So this 17A, which covers the labyrinth. Now endolymph is filled with a labyrinth. Here we receive voice, controller for reception of sound, static balance of body, and dynamic balance are situated here. Somebody is having some vertigo, like imbalance in the body. So use this point. Then triple warmer 17B. This is MP for cochlea, organ of hearing, through which we can hear the sound. MP for cochlea. Now TW18, SMP for inner ear and petrous bone. The petrous bone is the structure inside the ear which connects to the skull. This is petrous is the part of skull. Now, for what purpose we have to use this TW18 point? Disturbances of equilibrium or balance. Somebody is having some vertigo type of sensation, imbalance of the body. So use this point, TW18. When there is a disbalance while walking, then the reason could be problem in the ear. In this case, treat this point. Meniere's syndrome, Meniere's disease. Meniere's syndrome is a vertigo again. In this problem in the inner ear results in the less hearing and vertigo, both, along with hearing problem. So TW17A and B along with TW18. Now TW19 is MP for meninges in the brain, meninges. And TW20 is MP for hypothalamus. Now this can be used in all the hormonal disorders because hypothalamus is the control system of all the endocrine glands, even pituitary and pineal. Part of the brain which located under the thalamus is called as the hypothalamus. Correct. Okay, then what it controls? It is given anatomy again, this BHB. It controls the temperature on page number 64. It's temperature controller, wake and sleep mechanism, fat metabolism, water metabolism, genital function, perspiration, everything, hunger, feeding, everything. The functions of the hypothalamus. So TW20 in all autonomic nervous problems and all endocrine problems should be treated. Now TW21, PSMP anterior portion of the eye from lid to vitreous body. Eye problem TW21. TW22 is MP for glossopharyngeal nerve. TW23 is MP for superior temporomandibular joint. This inability to close the mouth. In that condition, we can use this TW23. And they have mentioned some information about the CV5. It's the alarm point for the endocrine, triple hormone. CV5 is the front shoe point or the alarm point. or whole triple hormone meridian or endocrine meridian. So in this way, this ends the 5th chapter, that is triple hormone meridian or endocrine meridian. So tomorrow we will be seeing this 6th chapter, 6, 7, 8, 9, 4 chapter again. We will cover it. You can read it out. If any difficulty, you can ask in the lecture. Okay, thank you very much for today's class. Next teacher will take your next class.